The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
A vision of beauty, a breathtaking view. Eyesight is a priceless treasure, but undetected glaucoma could steal you blind. Your heartbeat sets the rhythm of life, but what happens when it goes off-tempo? Can implantable devices keep your heart locked in a healthy beat? Arthritis can be a crippling nemesis, but a new blood test may help detect it early. If you think this tick is ugly, just wait until you see what one bite can do to you. Lyme disease. All this and more coming right up on Today's Health.
This program brought to you in part by Ciba Vision Ophthalmics and the Partners in Sight program, Medtronic, leaders in therapeutic medical technology, and Novodex, what the right diagnosis can do for you.
To see or not to see, that's a question we have more control over than we may realize. For those of us fortunate enough to have the gift of sight, preserving that sense is something we need to actively pursue. If we don't, a disease with virtually no detectable symptoms can sneak up and rob us blind before we can stop it. Hello, I'm Faith Daniels, and this is Today's Health. There are many myths about glaucoma, but one hard fact is that it can cause blindness if it goes undetected and untreated. What's the truth about this insidious disease, and what can we do to preserve our sight?
Whether yours are baby blue, limpid brown, emerald green, or mysterious hazel, we only have one set of eyes, and seeing an eye doctor for an examination and a check for glaucoma can mean the difference between preserving our vision or blindness.
It's very frightening, to know that you have a disease that would threaten to take away your precious sight.
Glaucoma is the second leading cause of blindness in America. It affects nearly 2 out of every 100 people. The real tragedy is that this disease can be controlled and sight can be preserved. But about half of the cases go untreated because it has no clear path or symptoms.
Glaucoma isn't a tumor, it isn't a growth, it isn't a cancer. It's a series of conditions that have in common the fact that the optic nerves, which are at the back of the eyes, the little cable that comes like a TV camera cable going up to the brain, well, the optic nerve is damaged. And the optic nerve is damaged by, in most cases, we feel pressure inside the eye. There is fluid that is made continuously inside the eye. Well, in some people, as they get older, in many cases, it turns out the drainage system doesn't work as well as it did when they were children. It doesn't stop completely, but it tends to just slow down. And if that happens, it slowly puts pressure on those delicate optic nerves that are at the back of the eye.
There are several types of glaucoma, but the most common condition is called open-angle glaucoma.
Open-angle glaucoma is often called the sneak thief of sight, because there are no symptoms. People do not have pain early on in the disease. They do not lose their good, clear central vision early in the disease. Simply the pressure in the eye is high enough to cause a loss of a number of nerve cells every day. So unless someone gets to their eye doctor and has the doctor detect this disease, they won't know what's happened. It sneaks up on them and takes their sight away.
Glaucoma can affect anyone, but the groups with the highest risk for the disease are people who are over the age of 40, those who have a family history of glaucoma, African Americans, diabetics, people with high blood pressure, and those who are very nearsighted.
Since glaucoma tends to be associated with being over age 40, certainly people who have had no eye problems their whole life should have their eyes examined by the time they're 35 or 40 years. The nerve damage caused by glaucoma is irreversible. Once it's occurred, you cannot restore that function to the eye. People will see less.
Before I knew that I had glaucoma, I did not get my eyes checked regularly.
There's a major advantage in early detection of glaucoma by preventing that kind of nerve damage. And since most early glaucoma is not detectable by the patient, the best thing to do is have it found out as part of a routine examination with your eye care professional.
What would we do without our vision? Well, most people would agree that the gift of sight is absolutely priceless. Well, if so, then preserving that gift is certainly worth the time it takes to get a regular eye examination.
Sometimes we don't appreciate how precious our vision is until we think about what life would be like without it. Glaucoma can be treated and controlled, but it requires patients to comply with treatments and become truly committed to preserving their sight.
Imagine a sink full of water with the faucet running at exactly the same rate as the drain. The level remains in equilibrium. If the drain slows, however, the sink will overflow unless you slow down the faucet. That sounds like a very simple example, but understanding the concept may be the key to understanding the treatment options for glaucoma.
Our major goal in detection and treating glaucoma is to prevent further damage to the eye. We do that usually by trying to lower the eye pressure as the major risk factor for glaucoma. And that's done either by the use of eye drops or lasers or in some cases surgery as well. In our country, the most common eye drops used to treat glaucoma in most patients are so-called beta blocker eye drops. They're drops that help to turn down that faucet that's going on in the eye. They reduce the production of the fluid that's building up in the eye and causing high pressure. An example of a beta blocker eye drop might be something like Timolol. One of the brands very commonly used is Betamol.
Other eye drops used to treat glaucoma include pilocarpine and epinephrine, which help to drain the fluid from the eye.
With helping to care for patients with glaucoma is for them to continue to use the drops for the rest of their lives. These people have a symptomless disease. They're not losing eyesight right away. There's no pain, nothing strange is going on. Just some doctor said there's a problem. Use these drops every day for the rest of your life. And of course you want to have good health, and you do. But after 3 weeks or 4 weeks, you say, nothing's happening. I'm not seeing better. I'm not seeing worse. Why am I putting these medications in every day for the rest of my life? And then people get casual and careless.
Sometimes I forget to take my glaucoma treatment. When I forget, I really feel sorry.
In order to stress the importance of compliance and help people with glaucoma preserve their vision, Ciba Vision Ophthalmics created a program called Partners in Sight. The program gives patients practical information on glaucoma and tips to help make taking their medicine a habit that's easier to follow. It attempts to improve the chances of controlling glaucoma and preserving sight through a combined effort between the patient, eye doctors, pharmacists, and pharmaceutical makers.
Glaucoma is like a thief in the night. It creeps upon you so sneakily. You never know unless you get your eyes checked.
Having glaucoma does not have to be a tragedy. With early detection, proper treatment, and strict compliance, patients can preserve their vision. And hopefully, someday soon, there may even be a cure.
It beats for us from womb to tomb, and most of the time our heart goes unnoticed until it suddenly speeds up or slows down. It could be a life-threatening crisis. How can technology help prevent the danger of an unnatural beat? When we return on Today's Health.
Some people think that an existence full of predictability can be monotonous. Others want consistency. But no matter how adventurous you want your life to be, it's important that your body remain consistent and predictable, especially your heart.
Can you feel the beat? The drummer often sets the rhythm for the music. To relax, the beat slows down. To excite, it speeds up. Our hearts drum the rhythm of our life. When we relax, it's between 60 and 70 beats a minute. When excited, it can be much faster. But what happens to people when their heart is out of sync? It can beat much too slow or dangerously fast.
When a heart beats too slowly, it generally means there's a decrease in the amount of blood pumped out of the heart for each heartbeat, and that results in symptoms, usually fatigue, shortness of breath, and occasionally fainting. When a heart beats too quickly, it usually results in very dramatic symptoms. Patients become lightheaded, dizzy, and have a feeling of either immediate fainting or impending doom. They are very uncomfortable with that.
Tachyarrhythmia is a disorder where the electrical signals that tell the heart to beat are coming too fast. It can develop as a result of heart disease, a heart attack, or a heart muscle disease known as cardiomyopathy.
There are several options that doctors have in treating abnormal heartbeats, whether they're too slow or too rapid.
In some cases, heart medications can help, but people can experience difficulties with the side effects. In some conditions, like bradycardia, there are no proven effective drugs. A non-medicinal way to regulate heartbeat can be with either a pacemaker or an implantable cardioverter defibrillator, ICD, like these developed by Medtronic.
Pacemakers and implantable defibrillators consist of very sophisticated circuitry, in essence, mini computers that are implanted in the body along with a battery system that can operate for up to 5 years. The major difference between a pacemaker and an implantable cardioverter defibrillator is that a pacemaker is a device that supports a very slow heartbeat and reestablishes a baseline heartbeat adequate for that patient. On the other hand, an implantable defibrillator stops a very rapid heartbeat. It literally interrupts a cardiac arrest automatically. The implantable pacemakers and defibrillators are extremely important to patients because they are automatically functioning devices that literally can jump in and save the person's life at a moment's notice. In essence, a defibrillator is an implanted paramedic system.
Our heartbeat can impact how well we live and even if we live. When it's not beating in time with good health, a device to help regulate the tempo may help get it back in sync with the rhythm of life.
Logging on the internet may actually be good for your health, especially if you visit our Today's Health homepage at www.vstar.com. You can get more information on any subject that we covered on the show, and there are even some extras waiting for you. We've all heard the saying, the early bird catches the worm. Well, many doctors believe that early intervention is often the key to fighting diseases, including arthritis. And now they're searching for more effective ways of detecting this crippler even before you feel it.
Hieroglyphics, the Chinese alphabet, and even some doctors' handwriting are all forms of communication most of us simply cannot decipher. In the world of healthcare, many researchers are examining blood samples in an attempt to understand the messages our body may be sending us. Our blood often gives doctors clues as to what is going on inside our body and where potential problems may be developing. As researchers better understand the language of our blood, they are becoming more effective at diagnosing conditions that may require treatment. In recent years, a great deal of effort has been concentrated on detecting signs of arthritis. Arthritis affects over 40 million people in this country. This disease has been around longer than humans. We have evidence that it even affected the dinosaurs. Still, we have no cure for it, and the primary way of diagnosing arthritis is from its terribly painful symptoms.
The two most common disorders that most people think of with arthritis, or that most people have, are osteoarthritis and rheumatoid arthritis. Osteoarthritis is a chronic degenerative arthritis. It's age-related. It can occur after trauma, and it affects certain parts of the body. Rheumatoid arthritis is what we call a systemic arthritis. It actually involves an aberration of the immune system that involves all the body and can therefore cause consequences in every part of the body, not just the joint. There are no miracle cures for arthritis.
Fortunately, better treatments and therapies are emerging, and in many cases, doctors believe that early diagnosis could help make the treatment outcome more positive.
Patients develop disability early in disease, and that if one wants to make an impact in ultimately diminishing the severity of this disability, one must make that impact early on in disease.
One potential tool that doctors may soon be able to use measures the disease activity in the joints by detecting the presence of the chondrex glycoprotein in the blood. The levels of chondrex, measured through a blood test developed by Novodex, a biotechnology company based in San Diego, California, may enable doctors to identify the disease earlier and gauge its severity and aggression. The changing levels of chondrex may also help monitor patients' response to different therapies and aid in designing an optimal treatment regimen. Could our blood be carrying messages from our joints? It may sound hard to believe, but it's clear that what's in our blood communicates many things going on in our body. And it may be very possible that we are being warned about the presence of arthritis before it becomes painfully obvious.
We'll be back with more on Today's Health.
Many people think that a walk outside or camping under the stars are stress reducers that are good for your health. Well, those activities may be wonderful, but in some areas an insect called the deer tick is spoiling the fun by spreading a bacteria that causes Lyme disease.
There's a predator in the woods. It's not a lion, a tiger, or a bear. It doesn't have fangs. In fact, you may not even see it. It's a deer tick. Bites from an infected deer tick can result in a baffling illness called Lyme disease.
I took my two nephews camping for their 16th birthday. They're a week apart. And we spent the night without a tent out in the soft grass. And when I woke up in the morning, all three of us were pretty much covered with ticks.
Every year in this country, about 10,000 cases of Lyme disease are reported, primarily from the northeastern and north central regions. But that endemic area is growing. Cases have recently appeared in Midwestern states, including Michigan, Kansas, Ohio, and Missouri.
Lyme disease is an infection which is transmitted by the bite of a tick, and it produces a variety of symptoms in the patient, from a rash to meningitis to arthritis. The various manifestations of Lyme disease imitate all sorts of different diseases which look very similar, making it very confusing sometimes for the clinician to decide what the best approach to therapy is. The first stage of Lyme, the early Lyme disease, is usually a rash accompanied by a flu-like illness, which is aching, fever, headache, neck stiffness. If you didn't see the rash, those symptoms could be almost anything.
The symptoms I experienced were very much flu-like. I had a lot of body aches. I had a fever that wasn't a high-grade fever, but it would come and go a lot.
In the early stages of Lyme disease, oral antibiotics work exceedingly well. The cure rates are 95% plus if you use the right antibiotic. And the duration of treatment is usually 2 to 3 weeks, and that's perfectly adequate. After that initial episode, the initial stage of Lyme, one can then develop a second stage, which can involve the heart, it can involve the brain and the nervous system, and one of the classic presentations of Lyme at this stage is Bell's palsy, which is paralysis of one half of the face. Those patients that don't respond to the antibiotics, they're usually considered to be late Lyme disease or stage 3. Later Lyme disease is again, a varied picture of anything from arthritis with hot swollen joints to persistent fatigue, memory loss, confusion, and there may be some peripheral nerve involvement with numbness or paralysis.
I appreciate being well a lot more now. I didn't realize it, or I took it for granted before, and now I really don't. If they would have caught it any later than they did, then I would have been in a lot of trouble.
Because of the complicated nature of Lyme disease, the varied presentations, the fact that it's a great imitator, and the fact that some patients are not cured, we would love to have a vaccine that would prevent these cases.
Incidents of Lyme disease are characteristically found in regions where wild deer roam and the parasitic deer tick thrives. Right now in those areas across the country, that persistent little arachnid is creating a major health problem.
Preventing a problem is usually better than having to deal with one. It's especially true when talking about illnesses that can be avoided, like Lyme disease. While researchers and doctors are currently testing vaccines, you can help yourself by taking a few simple precautions.
Legends often tell of vampires, undead creatures with a thirst for blood. But in reality, this little bloodsucker is a far bigger monster.
If you're going to be out backpacking or camping or just hiking through a field somewhere, you should be concerned about Lyme disease because you can get it from a tick just about anywhere.
It's important to wear light clothing because light clothing makes it easier to detect ticks. To try to cover as much area as you can, particularly below the waist. If you've been out hunting or fishing and you've been in the brush, you need to check yourself at the end of the day or even during the day to see if you might have a tick on you. And it's important that you spend a little time doing this because these ticks are very small, particularly the deer tick that transmits Lyme disease. The tick has three main stages in its life. The larva is the newborn tick, if you will, that then molts into a nymph, which then becomes an adult. Now, any of the stages can transmit Lyme disease, but for humans, the biggest risk is with the nymph and the adult. Ticks will transmit Lyme disease and other tick-borne infections whenever the weather is above freezing.
As cases of Lyme disease continue to appear across the country, the race for a vaccine to prevent the disease is on.
There are two companies developing vaccines at the present time, and as we've discussed, vaccine development is something that we're all looking forward to in order to resolve some of the very difficult issues that we face in the diagnosis and management of Lyme disease.
Until a vaccine for Lyme disease becomes available, experts recommend everyone take preventive measures when outdoors in or near wooded areas. A few simple precautions may help you avoid a tick bite and a very serious illness.
What's the key to good health? If you asked 5 doctors, you'd probably get 5 different answers. Unfortunately, there is no one thing you can do to guarantee your well-being. But if you make your health a priority with regular exercise, a healthy diet, and routine visits to your doctor, you might prevent an illness before it becomes a problem. I'm Faith Daniels. For more information on any of our stories, visit our internet website at www.vstar.com. And join us again next time as we get right to the heart of the matters affecting your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.